Friends, let's know about hypersensitivity. In this video, we will discuss about classification. Under classification, we will study about type 1 reaction, type 2 reaction, type 3 reaction, type 4, type 5, and Shwartzman reaction. So, let's begin. Immune response is generally a protective process, but it may sometimes be injurious to the host. Hypersensitivity refers to a condition in which immune response results in excessive reactions, leading to tissue damage, disease, or even death in the sensitized host. Hypersensitivity occurs in individuals who have had previous contact with the antigen or allergen. The initial contact sensitized the initial contact sensitizes the immune system by priming appropriate B and T lymphocytes. It is known as priming or sensitizing dose. Subsequent contact with the same antigen causes hypersensitivity. It is known as shocking dose. These allergens may be complete allergens or haptens. Allergy is most commonly used as a synonym for hypersensitivity. The term allergy means an altered state of reactivity to an antigen. It may include both protective as well as injurious immune response. This term allergy was originally coined by von Percute in 1905. Now let's know about the classification. Hypersensitivity reactions are classified into two main types, that is immediate and delayed type, based on the time required by sensitized host to develop clinical reactions upon exposure to the shocking dose of the antigen. The major differences between the two hypersensitivity reactions now we will discuss. Comb and gel in 1963 classified hypersensitivity reaction into four major types, that is type 1 to type 4. Type 1 is otherwise called as anaphylactic, type 2 is otherwise known as cytotoxic, type 3 is known as immune complex, and type 4 is called delayed or cell mediated. Type 1, type 2, 3 depends on the interaction of antigen with humoral antibodies and are known as immediate type reactions. Type 4 reaction is mediated by T lymphocytes. Reaction developed in 24 to 72 hours and is called delayed hypersensitivity reaction. Later on, type 5 hypersensitivity reaction was also described. Now let's know about type 1, that is anaphylactic. We will discuss. Antibodies, that is IgE type, are fixed on the surface of tissue cells, that is mast cells and basophils in sensitized individuals. The antigen combines with the cell-fixed antibody, leading to release of pharmacologically active substances which produce the hypersensitivity reaction. Now let's know about type 2, that is cytotoxic. It is a cytotoxic reaction mediated by antibodies that react with antigens present on the surface of cell or other tissue components, resulting in damage of the cell. Combination with antibody may sometimes cause stimulation instead of cell damage. An example is long-acting thyroid stimulator, in short LATS, an antibody against thyroid cells which stimulates the excessive secretion of thyroid hormone. Now let's know about type 3, that is immune complex. The damage is caused by antigen antibody complexes. These complexes may be deposited in tissue causing immune complex disorders. Now let's know about type 4, that is delayed or cell mediated. The tissue damage is mediated by T lymphocytes and not by antibody, hence is also called cell-mediated hypersensitivity. The antigen activates specifically sensitized T lymphocytes which lead to the secretion of lymphokines with fluid and phagocyte accumulation. Now let's know about type 5 stimulatory type. It is a modification of type 2 hypersensitivity reaction. Antibodies interact with antigens on cell surface and that leads to cell proliferation and differentiation instead of inhibition or killing. Antigen-antibody reaction enhances the activity of affected cell. Now let's know about type 1, that is anaphylactic reaction. Anaphylaxis is the classical example of type 1 hypersensitivity reaction. It is IgE mediated reaction. The term anaphylaxis, that is ana means without, phylaxis means protection, was described by Richet in 1902, who observed that dogs who had survived a subtlethal dose of toxic extracts of C. anemones were rendered highly susceptible to minute doses of the same extract given days or weeks later instead of becoming immune to it. Type 1 reactions occur in two forms: the acute, potentially fatal systemic form called anaphylaxis and recurrent non-fatal localized form called atopy. Now let's know about mechanism of anaphylaxis. Anaphylaxis occurs when a sensitized individual comes in contact with a shocking dose of antigen. Sensitization may occur by any route such as parenteral inhalation or ingestion, but most effective route is parenteral. Antigens as well as heptins may induce anaphylaxis. An interval of 2 to 3 weeks is required between sensitizing and shocking dose, during which cytotropic antibody, that is IgE, previously known as reagonic antibody, produced against the antigen attaches to surface receptors of mast cells and basophils. IgE molecules bind to this receptor by their Fc end. Once sensitized, the individual remains so for a long period. When a shocking dose of the same or immunologically related antigen is given, the antigen combines with cell-bound IgE antibody on mast cells rapidly. The antigen-antibody complex stimulates mast cells and basophils to release mediators that cause clinical manifestations of anaphylaxis. Shocking dose is most effective when given intravenously, less effective subcutaneously, and least effective intradermally. Now let's know about chemical mediators. The chemical mediators are of two types: primary mediators, which are the preformed content of mast cell and basophil granules, and the secondary mediators, which are newly formed upon stimulation of mast cells, basophils, and other leukocytes. Now let's know about primary mediators. Example: histamine, serotonin, eosinophil, chemotactic factor of anaphylaxis, neutrophil chemotactic factor of anaphylaxis, various proteolytic enzymes. Now let's know about histamine. This is the most important in human anaphylaxis. It is formed by the decarboxylation of histidine present in the granules of mast cells, basophils, and in platelets. It causes dilatation, increased capillary permeability, and contraction of smooth muscle. Now let's know about serotonin. It causes vasoconstriction, increased capillary permeability, and smooth muscle contraction. It is found in the brain tissue, intestinal mucosa, and platelets. Eosinophil chemotactic factor of anaphylaxis. It is in short ECFA. We will discuss about this. These are released from mast cell granules and are strongly chemotactic for eosinophils. This probably contribute to hypersensitivity, probably contribute to eosinophilia associated with many hypersensitivity contractions conditions. Another chemotactic factor which attracts neutrophil is known as neutrophil chemotactic factor of anaphylaxis. Now let's know about proteolytic enzymes. Proteases and hydrolases are also released from mast cell granules. Now let's know about secondary mediators. Example, slow reacting substances, in short SRS, prostaglandins and thromboxane, platelet activating factor, that is in short PAF, cytokines such as IL-3 to IL-6. IL means interleukin 3, interleukin 6, GM-CSF, IL-1, INF gamma and INF alpha. Now let's know about slow reacting substance of anaphylaxis. In short, SRSA. It is produced by leukocytes. These are much more potent bronchoconstrictors than histamine. These are principal mediators in bronchoconstriction of asthma. They cause sustained contraction of smooth muscles. These are not inhibited by antihistaminics. Now let's know about prostaglandins and thromboxane. Both of these are derived from arachidonic acid, which is formed from disrupted cell membranes of mast cells and leukocytes. Prostaglandins F2A is a bronchoconstrictor. Thromboxane A2 is also a powerful but transient bronchoconstrictor. Now let's know about platelet activating factor, in short PAF. It is released from basophils which cause aggregation of platelets and release of their vasoactive amines. Now let's know about other mediators of anaphylaxis. These are the anaphylactoxins released by complement activation and bradykinin and other kinins from plasma kinogens. Now let's know about some features of anaphylaxis. Anaphylaxis occurs within a few seconds or few minutes following shocking dose of antigen. Next point is cytotropic IgE antibody is responsible. Tissue or organs which are affected in anaphylaxis are called target tissues or shock organs. Lungs is the principal shock organ in humans. Bronchospasm, laryngeal edema, respiratory distress, shock and death may occur. It may be induced artificially by serum of sensitized individual. It is not related to heredity. Now let's know about type of anaphylaxis. Apart from systemic anaphylaxis, there are other types of anaphylaxis which are we will discuss, which we will discuss now. Anaphylaxis, first point is anaphylaxis in vitro, that is in short otherwise called as Schutz-Delle phenomenon. Schutz-Delle phenomenon. Isolated tissues, that is uterus or ileum, from sensitized guinea pigs when kept in a bath of Ringer solution, the organ contracts vigorously to the bath and vigorously on addition of the specific antigen to the bath. This is named as Schutz-Delle phenomenon. Second point is cutaneous anaphylaxis. Cutaneous anaphylaxis may be induced when a small shocking dose of an antigen is administered by intradermal route to a sensitized host. It is manifested by appearance of local wale and flare response. Cutaneous anaphylaxis is useful in testing for hypersensitivity and in identifying the allergen responsible in atopy. Now let's know about passive cutaneous anaphylaxis, in short PCA. This is a sensitive in vivo method for detection of antibodies. A small volume of the antibody is inoculated intradermally into a normal animal. If the antigen along with a dye Evans blue is injected intravenously 4 to 24 hours afterwards, their interdermal injection due to vasodilatation and increased capillary permeability well and flare reaction occurs. PCA can be used to detect human IgG antibody which is heterocytotropic. That means antibody is capable of fixing cells of other species but not IgE which is cytotropic. That means can fix to cells of homologous species only. Now let's know about atopy. The term atopy meaning out of place or strangeness, was first introduced by Koka, that is in 1923, to refer to familial hypersensitivities which occur spontaneously in man. It is typified by hay fever and asthma. The antigens commonly involved in atopy are pollens, house dust, and food. These atopens induce IgE antibodies formerly termed as reagin antibodies. Atopic sensitization occurs spontaneously following natural contact with atopens. Predisposition to atopy is genetically determined, probably linked to MSC genotype. Now let's know about the features of atopy. Atopy runs in families. These individuals have the tendency to produce resin antibody in unusually large amounts. Reactions occur at the site of entry of the antigen. Inhalation of pollens affect lungs, bronchial asthma, ingestion of fish, milk, eggs, drugs, etc., gastrointestinal disorders or cutaneous eruptions, and contract leads to local allergy conjunctivitis. It is IgE mediated hypersensitivity reaction. IgE is homocytotropic, that is specific. Only human IgE can fix to the surface of human cells. Induction of atopy is difficult artificially because atopens are poor antigens. Now let's know about mechanism of atopy. The atopen combines with the cell-bound IgE antibodies fixed on the surfaces of mast cells and the basophils, and this antigen antibody complex stimulates these cells to release the mediators, resulting in clinical feature of atopy. Example, food allergy, that means egg, mushroom, prawn, shellfish, etc. Next point is dust allergy. Example, pollens of ragweeds, grasses or trees, house dust, like this. And another example is drug allergy, that means penicillin, sulfonamides sometimes gives allergy. Next point, let's know about proud needs Kushner reaction, in short PK reaction. This was originally this was the original method for detecting atopy antibody. Proud sneeze and Kushner in 1921 reported that if serum collected from Kushner, who had a gastrointestinal allergy to certain cooked fish, was injected intracutaneously into Proust's, followed by 24 hours later by injecting small amount of cooked fish extract into the same site, a well and flare reaction occurs occurred at the site of injection within minutes. The special affinity of IgE for skin cells forms the basics of PK reaction. As reagenic IgE is performed on human skin, this test is not done nowadays due to risk of transmission of serum hepatitis. In vitro methods for detection of IgE include radioallergy allergosorbent test, in short RAST, ELISA, and passive agglutination. Now let's know about anaphylactoid reaction. This reaction resembles anaphylactic shock clinically and is provoked by intravenous injection of peptone, trypsin, and some other substances. It has a non-specific mechanism involving the activation of a complement pathway with release of anaphylactic toxins. It has no immunological basis. The clinical resemblance is due to action of same chemical mediators participating in both reactions. Now let's know about type 2 reaction. Type 2, that means cytotoxic reaction. Cytotoxic reaction is mediated by IgG or rarely IgM antibodies directed against antigens on the surface of cells, resulting in cell damage. Antibodies bind to an antigen on the cell surface and cause phagocytosis of the cell through opsonic or immune adherence. Cytotoxicity by natural killer NK cells and lysis through activation of complement system. Example: autoimmune anamyasitis and hemolytic disease of the newborn. Lysis of red cells occur due to formation of anti-erythrocyte antibodies. Now let's know about drug reactions. Sedomid purpura is a classical example of drug reaction. A sedative drug, sedomid, not used nowadays, combines with platelets and antibodies are formed against these sedomid coated platelets. On subsequent exposure to drug, antibodies attack the platelets, leading to thrombocytopenic purpura. Other drugs such as sulfonamide, thiazide, diuretics, and quinidine cause similar type of purpura. Many drugs attached to the cell membranes of erythrocytes, neutrophils, or platelets and leads to antibody formation. On subsequent exposure to drugs, antigen-antibody reaction produces cytotoxic or cytolytic reaction, that is hemolysis. Now let's know about demonstration of type 2 reaction. Combs test is usually positive, that is direct antiglobulin test. Let's know about type 3, that is immune complex reaction. It is characterized by deposition of antigen antibody complexes in tissues, activation of complement and filtration of polymorphonuclear leukocytes leading to tissue damage. Two types type 3 reaction include arthros reaction due to relative antibody excess and serum sickness because of relative antigen excess. Now let's know about Arthurs reaction. Arthurs in 1903 observed that with repeated subcutaneous injections of normal horse serum, that is antigen, into rabbits, the initial injections were without any local effect, but with later injections, intense local edema and hemorrhagic necrosis develop. This type of reaction is called Arthurs reaction. The tissue damage is due to antigen antibody complexes formed at equivalence or slight antibody excess. The antigen antibody complexes are deposited on the walls of blood vessels. These complexes activate complement and attract neutrophils at the local site. Leukocyte platelet thrombi are formed which reduce the blood supply and cause tissue necrosis. The Arthur's reaction can be passively transferred with sera containing high titer of antibodies, that is IgG and IgM. Now let's know about serum sickness. It is a systemic form of type 3 hypersensitivity reaction. It appears following a single injection of high concentration of foreign serum. Antibodies to foreign serum reach high enough titer by 7 to 12 days, but still some excess antigen remains in the circulating blood. Immune complexes get deposited on the endothelial lining of blood vessels in various parts of the body, causing inflammatory infiltration. Massive complement activation and fixation by antigen antibody complexes leads to fall in complement concentration. Serum sickness differs from other hypersensitivity reaction in that a single injection serves both as the sensitizing and shocking dose. Immune complexes damage the tissue in the same way as that in Arthur's reaction. Serum sickness is characterized by fever, urticaria, arthralgia, lymphadenopathy, and splenomegaly. Some important immune complex diseases are post-streptococcal glomerulonephritis, endocarditis, hepatitis B, dengue, hemorrhagic fever, and malaria. Now let's know about type 4, that is delayed or cell mediated reaction. The reaction is mediated by sensitized T lymphocytes which on contact with specific antigen release lymphokines that cause biologically if effective in macrophages, leukocytes and tissue cells. In contrast, all other hypersensitivity reactions are induced by circulating antibodies. Type 4 or delayed type of hypersensitivity occurs within 48 to 72 hours of antigen challenge. As it is not antibody mediated, it cannot be passively transferred by serum but can be transferred by lymphocytes or transfer factor. Two types of delayed hypersensitivity reaction are well recognized, that is tuberculin infection type and contract dermatitis type. Now let's know about tuberculin or infection type. When a small dose of tuberculin is injected intradermally in an individual sensitized to tuberculoprotein by prior infection or immunization, an erythema and swelling occurs at the site of injection within 48 to 72 hours. The injection site is infiltrated by large number of lymphocytes and about 10 to 12% macrophages. In unsensitized individuals, the tuberculin injection provokes no response. Purified protein derivatives, which is the active material of tubercle bacilli, is used in tuberculin test. The tuberculin test is a useful indicator for delayed hypersensitivity to the bacillus. Cell-mediated hypersensitivity reaction develops in many infections with bacteria, M. tuberculosis, M. leprae, fungi and parasites. It occurs when infection is subacute or chronic and pathogen is intracellular. Various skin tests are performed to detect delayed type of hypersensitivity. Positive skin test does not indicate present infection but implies that the person has been infected or immunized by the microorganism in the past. Some of these skin tests include leprosy test, free test, and histoplasmin test. Leprosy test, let's know about leprosy test. It is positive in tuberculoid leprosy but negative in lepromatous type of leprosy. Free test, Pretest means this test is positive in lymphogranuloma venereum. In short, LGV. Next is histoplasmin test. It is positive in histoplasmosis. That means a fungal infection caused by histoplasma cap capsulatum. Now let's know about contact dermatitis type. Delayed hypersensitivity may sometimes develop as a result of skin contact with a range of sensitizing metals like such as nickel and chromium, drugs such as penicillin or other antibiotics in ointments, simple chemicals like hair dyes, picryl chloride, dinitrochlorobenzene, cosmetics and soaps. These substances can act as heptins. After absorption through skin, these molecules combine with skin protein to become antigenic. Cell-mediated immunity is induced in skin as most of the antigens involved in fat soluble. They are likely portal of entry is along the sebaceous glands. Sensitization is particularly liable to occur when the chemical is applied in an oily base on an inflamed area of the skin. The Langerhans cells of skin carry these antigens to regional lymph nodes where T lymphocytes are sensitized. On subsequent exposure to the offending agent, sensitized lymphocytes release lymphokines which cause superficial inflammation of skin characterized by redness, induration, vesiculation within 24 to 48 hours. The dermis is infiltrated predominantly by lymphocytes and few macrophages. Now let's know about the detection. First is patch test. The suspected allergen is applied to a small area of skin under an adherent dressing. Sensitivity is indicated by itching appearing in 4 to 5 hours and local reaction after 24 to 48 hours. Now let's know about type 5, that is stimulatory type reaction. It is a modification of type 2 hypersensitivity reaction. Antibodies interact with antigens on cell surface and cell surface that leads to cell proliferation and differentiation instead of inhibition or killing. Antigen antibody reaction enhances the activity of affected cell. The typical example is Graves' disease, in which thyroid hormones are produced in excess quantity. Long acting thyroid stimulating antibody is an autoantibody to thyroid membrane antigen. It is presumed that LATS combines with a TSH receptor on thyroid cell surface and produces the same effect as TSH, resulting in excessive secretion of thyroid hormone. Now let's know about Shwartzman reaction. It is not an immune response, but it has superficial resemblance to hypersensitivity reaction. It is probably a specialized type of intravascular coagulation precipitated by endotoxin. Shwartzman in 1928 injected a culture filtrate of S-Tiffy intradermally in a rabbit, and same filtrate was injected intravenously after 24 hours. A hemorrhagic necrotic lesion developed at the site of intradermal inoculation. The initial intradermal, that means preparatory injection, causes accumulation of leukocytes which by release of lysosomal enzymes damage capillary walls. Following the intravenous injection, there occurs intravascular clotting, the thrombi leading to necrosis of vessel walls and hemorrhage. This is known as Shwartzman reaction. When both preparatory and provocative doses are given intravenously, the animal dies 12 to 24 hours after the second dose. Autopsy reveals bilateral cortical necrosis of kidneys, and patchy hemorrhagic necrosis in other organs such as liver, spleen, etc. The reaction is also called as the Shwartzman reaction or the generalized Shwartzman reaction. Mechanism similar to Shwartzman reaction may operate in certain clinical conditions such as fulminating meningococcal septicemia. Finally finished. Any questions regarding this? You can ask me in the comment box and subscribe my channel for more updates. Thank you.